Hey everyone, Dr. Eric Madison here.
And Sato Makoto. Eric, I want to start with something that's going to surprise people.
Go ahead.
Last month, a 72-year-old woman came to me. She'd been getting every medical test her doctor recommended. Annual full checkups, stress tests, cancer screenings. She thought she was being responsible.
And?
Her medical bills were over $8,000 a year. 3 false alarms led to invasive procedures. One of those procedures caused an infection that put her in the hospital for a week.
Here's what nobody tells you. After 65, the rules change. Tests that made sense at 50 or 60, some of them become dangerous. Not because the tests are bad, but because your body and your risk profile is completely different.
In Japan, we have a concept. Yobo. Prevention, yes, but also knowing when to stop looking for problems that aren't there.
Today we're covering 6 medical tests. 3 you should probably avoid after 65, despite what your doctor might say. And 3 you absolutely cannot skip because they're lifesavers.
And we're going to tell you exactly why, with real patient stories, so you can walk into your next doctor's appointment informed.
If you're over 65, or you have parents or loved ones in that age range, this episode could literally add years to your life, or save you from unnecessary procedures that could harm you.
By the end, you'll have a checklist. Print it, take it to your doctor, ask the right questions.
And hey, drop a comment below right now. How many medical tests did you have last year? We want to know if you're overscreened or underscreened.
Let's start with the first test you should probably skip. Eric, this one's going to be controversial.
Oh, I know. People are going to argue with me in the comments, but the data is clear.
Imagine your brand not as a logo, but as a person telling a story at a dinner table. In 2025, your audience craves authenticity, relatability, and clear value. A short-form video explaining how your product solves a real problem can outperform flashy ads. Remember, 82% of people buy from brands they trust. Build trust, share stories, and let your customers speak for you.
The annual full checkup. All right, let's talk about it. For decades, it's been this sacred ritual in American medicine. Every January, like clockwork, people call my office. Time for my annual. But after 65, it can be a problem.
How so?
The comprehensive head-to-toe exam every single year for someone with no symptoms, no new concerns. It's often unnecessary. And here's the kicker. It can lead to harm.
In Japan, we have a different approach. We focus on what we call kenko shindan. Health checks, yes, but targeted. Not everything everywhere all at once.
Exactly. Let me tell you about Margaret. She was 68, retired librarian, healthy as a horse, came in for her annual physical. I ordered the usual battery of tests. Her chest x-ray showed a tiny nodule.
Probably nothing?
Probably nothing. But we couldn't ignore it. So we did a CT scan. That showed the nodule more clearly, but also raised questions. Next step? Biopsy. She had no symptoms. No cough, no shortness of breath, nothing.
What happened?
She developed a pneumothorax, collapsed lung from the biopsy. Ended up hospitalized for 5 days, had to have a chest tube, was on oxygen for 2 weeks at home.
All for a nodule that turned out to be
A harmless calcification. Probably been there for 20 years. Your body accumulates artifacts, little abnormalities that show up on tests but don't mean anything.
Your body at 70 is not supposed to look like your body at 30. Some wear and tear is normal. We call this kashoshindan, overdiagnosis.
Here's what the research shows. Multiple studies, including a big one from the Cochrane collaboration, found that annual physicals for healthy adults don't reduce mortality. They don't make you live longer.
But they do increase costs and unnecessary procedures.
Significantly. One study estimated that if every American over 65 got a full annual physical, we'd generate over 25 million abnormal findings that would need follow-up. Most of them false alarms.
So what should people do instead of the annual physical?
Targeted visits. If you have diabetes, see your doctor every 3 to 6 months to manage that. If you have high blood pressure, regular monitoring. If you have new symptoms, chest pain, unexplained weight loss, persistent cough, absolutely see your doctor right away.
But not the full body scan approach?
Not unless there's a specific reason. Your doctor should be asking, what are your risk factors? What's your family history? What symptoms are you experiencing? and then screening for those specific things.
In Japan, elderly patients often come with a list. Very specific concerns. Not check everything, but I've noticed this. I'm worried about that.
That's the right approach. And here's something else. After 65, you're already getting targeted screenings. Colonoscopies for colon cancer, mammograms for breast cancer, blood pressure checks. These are evidence-based. They save lives.
So the annual physical becomes redundant?
Often, yes. You're already getting the screenings that matter. The comprehensive exam just adds noise. More tests that might find things that don't need finding.
But I can hear our viewers thinking, my doctor says I need this. Are you saying my doctor is wrong?
I'm saying medicine has changed. The American Board of Internal Medicine, through the Choosing Wisely campaign, has actually recommended against routine annual physicals for healthy adults. Your doctor may not be up to date, or may feel pressure because patients expect it.
So how do you have this conversation with your doctor?
You say, I've read that annual comprehensive exams aren't recommended for healthy people over 65. Can we talk about what screenings I actually need based on my specific risk factors? Most good doctors will respect that question.
And if they push back?
Ask them, what will this test change about my treatment? If we find something, what's the next step? If the answer is vague, or if it's, we'll cross that bridge when we come to it, that's a red flag.
Your time, your body, your decision. Medicine should serve you, not the other way around.
Now, I want to be clear. If you have chronic conditions, if you're on multiple medications, if you've had recent health changes, you absolutely need regular doctor visits. We're talking about the healthy 65-year-old who's just going through the motions.
Save your time, save your money, and avoid unnecessary procedures. That's not being irresponsible. That's being smart.
Next one is even more controversial. The cardiac stress test.
This will be interesting.
Okay, this is where I'm going to lose some cardiology colleagues. But I'm saying it anyway. If you're over 65, have no symptoms, and your doctor wants to order a routine stress test just to check, you should probably say no.
You're a cardiologist. And you're telling people to skip heart tests.
I'm telling people to skip unnecessary heart tests. Big difference. The cardiac stress test, whether it's on a treadmill or with medication, is designed to find blockages in your coronary arteries. Sounds great, right? Catch problems early?
That's what most people think.
Here's the problem. After 65, especially if you have no symptoms, no chest pain, no shortness of breath, no dizziness, the likelihood of a false positive skyrockets.
False positive, meaning the test says there's a problem, but there isn't.
Exactly. And here's where it gets dangerous. When a stress test comes back abnormal, what's the next step? Usually a cardiac catheterization. We thread a camera through your artery to look at your heart. Sounds minimally invasive, but it's not without risk.
What kind of risks?
Bleeding, infection, kidney damage from the contrast dye, even stroke in rare cases. All because of a screening test on someone who felt fine. I had a patient, Robert, 72 years old, playing tennis 3 times a week, no symptoms whatsoever.
His doctor ordered a stress test?
Just to be safe. It showed what looked like reduced blood flow to part of his heart, so we did the catheterization. His arteries? Perfectly clear. The stress test was wrong. But he'd already been through an invasive procedure.
Did he have complications?
Fortunately, no. But he was terrified for 2 weeks thinking he had heart disease. And he paid $12,000 out of pocket for tests he didn't need. After 65, your heart naturally shows some changes. The electrical signals slow down a bit. The heart muscle doesn't squeeze quite as vigorously.
Aging is not disease. In Japan, we accept that the 70-year-old heart works differently than the 30-year-old heart. That's normal.
Right. So when we put a 70-year-old on a treadmill and stress their heart, we're more likely to see abnormalities that don't actually mean blockages. The test isn't designed for aging hearts without symptoms.
So when should someone over 65 get a stress test?
If you have symptoms, chest pain or pressure, especially with exertion, shortness of breath that's new or worsening, dizziness or fainting, those are red flags. Or if you have multiple risk factors, diabetes, high blood pressure, family history of early heart disease, and you're about to start a vigorous exercise program.
So it's not never get the test. It's get it when there's a reason.
Exactly. The key word is symptoms or specific risk factors. Not just because you turned 65. Here's what the American College of Cardiology says. Routine screening stress tests in asymptomatic adults do not improve outcomes. They don't prevent heart attacks. They don't make you live longer.
But they do lead to more procedures.
They do. There's even a term for it, the cascade effect. One test leads to another, leads to another. Before you know it, you're on medications you don't need, or you've had a stent placed in an artery that wasn't even causing problems.
This is why informed consent matters. You have the right to ask, why are we doing this test? What will we do differently based on the results?
And if your doctor says it's just routine or everyone your age gets it, that's not a good answer. There should be a specific clinical reason based on your individual health.
What about people who say, but I want to be proactive. I want to catch things early.
I understand that impulse. But being proactive doesn't mean testing everything. It means knowing your numbers, blood pressure, cholesterol, blood sugar. It means exercising, eating well, not smoking. Those things prevent heart disease. Random screening tests on healthy people? They don't.
In Japanese medicine, we say, yobo wa chiryō ni masaru. Prevention is better than treatment. But prevention means lifestyle, not endless testing.
Well said. All right, the third test to avoid is the most controversial of all. And I'm going to lose a lot of people on this one. We're talking about PSA screening for prostate cancer after age 70.
This is going to be polarizing.
I know, but the data is clear. For most men over 70, routine PSA testing does more harm than good.
Let's talk about why. Because many men believe this test saves lives.
It can, in certain situations. But after 70, the calculus changes dramatically. Here's the reality. Prostate cancer is incredibly common in older men. If we did autopsies on men who died of other causes, about 50% of men in their 70s have prostate cancer.
But they didn't die from it?
They didn't even know they had it. Most prostate cancers in men over 70 grow so slowly that they'll never cause symptoms. You're far more likely to die with prostate cancer than from it.
So finding it doesn't necessarily help.
Often it causes harm. Because once we find cancer, we feel compelled to treat it. And the treatments, surgery or radiation, they have serious side effects. Urinary incontinence, erectile dysfunction, bowel problems. These significantly impact quality of life.
For a cancer that might never have caused problems?
Exactly. I had a patient, Frank, 74 years old. His PSA came back slightly elevated. We did a biopsy, found a small, low-grade cancer. He wanted it out. We did the surgery. Now he wears pads every day for leaking, and his relationship with his wife has suffered.
And the cancer?
Would likely never have progressed. We could have just watched it. But the anxiety of knowing he had cancer, he couldn't live with that. This is the psychological burden of screening. Sometimes, ignorance truly is bliss.
In Japan, we have a saying, shikata ga nai. It cannot be helped. Some things we must accept. Not everything needs intervention.
Western medicine struggles with that concept. We want to fix everything. But after 70, fixing can cause more problems than the disease itself. The U.S. Preventive Services Task Force actually recommends against PSA screening for men over 70.
So no man over 70 should get the test?
Not exactly. If you're in excellent health and have a life expectancy of more than 10 to 15 years, if you have strong family history, or if you have symptoms like difficulty urinating, blood in urine, bone pain, then testing makes sense.
But routine screening just because you're a man and you're 75?
Probably not worth it. You're more likely to be harmed by the treatment than helped by finding the cancer. This is a conversation every man needs to have with his doctor. Weigh your individual risks versus benefits.
And this is true shared decision-making. Not just doing tests because they're available, but understanding what they mean for your specific situation.
All right, we've covered the 3 tests to avoid or be very cautious about after 65. Annual full physicals, routine cardiac stress tests, and PSA screening after 70. Now let's flip it. Let's talk about 3 tests you absolutely cannot skip.
These are the lifesavers, the screenings that actually make a difference. First one, colonoscopy.
Colon cancer is the 3rd leading cause of cancer death in the United States. But here's the good news. It's one of the most preventable cancers, because we can find and remove precancerous polyps before they become cancer.
How often should people get colonoscopies?
For most people, every 10 years starting at age 45. But after 65, especially if you've had polyps before, you might need them more frequently, every 5 years. And you can usually stop at age 75 if your previous screenings were normal.
But many people avoid this test. They're embarrassed or scared of the prep.
I get it. The prep is unpleasant. You're drinking a gallon of laxative solution, spending the night in the bathroom. But that one uncomfortable day could save your life. I had a patient, Linda, 67 years old. She'd been putting off her colonoscopy for years.
What made her finally do it?
Her sister was diagnosed with stage 4 colon cancer. Linda got her colonoscopy the next month. We found 3 large polyps. One was already showing early cancerous changes. We removed them right then and there during the procedure.
She caught it just in time?
Just in time. If she'd waited another year or two, it would have been full-blown cancer, requiring surgery, chemotherapy, the works. Instead, she had a 30-minute procedure and went home the same day. That's the power of screening.
In Japan, colorectal cancer rates are rising as our diet becomes more westernized. We're now recommending earlier and more frequent screening.
The key is, if you're between 45 and 75, get your colonoscopy. Don't put it off. Yes, the prep is annoying. Yes, it's embarrassing. But it's one day of discomfort versus potentially years of your life.
And there are alternatives now, right? Stool tests?
Yes, tests like Cologuard that you do at home. They're better than nothing, but they're not as accurate as colonoscopy. They can miss polyps. If you get a positive result, you still need a colonoscopy. So if you can do the colonoscopy, that's the gold standard.
What are the warning signs people should watch for between screenings?
Blood in your stool, even a little bit. Changes in bowel habits that last more than a few weeks. Unexplained weight loss. Persistent abdominal pain. Feeling like you can't empty your bowels completely. Any of those, you call your doctor immediately. Don't wait.
Second critical screening. Comprehensive eye exam every year after 60. Eric, many people don't realize how important this is.
Vision screening saves lives. Not just eyesight, but lives. Because poor vision is the #1 risk factor for falls in older adults. And falls are the leading cause of injury death in people over 65.
Vision causes falls?
Think about it. If you can't see that step clearly, if you misjudge the curb, if you don't notice the rug is wrinkled, you fall. And after 65, falls have catastrophic consequences. Hip fractures, head injuries, loss of independence.
What conditions are we screening for?
Glaucoma, which causes gradual vision loss and has no early symptoms. Macular degeneration, the leading cause of blindness after 60. Diabetic retinopathy if you have diabetes. Cataracts, which can be surgically corrected. All of these can be caught early with a comprehensive eye exam.
Not just a vision test for glasses.
No. A comprehensive exam with dilation, where they check the pressure in your eye, examine the retina, look at the optic nerve. This should be done by an ophthalmologist or optometrist every year after 60.
I had a patient, 71-year-old man. He thought his vision was fine, but his wife noticed he was bumping into furniture, misjudging distances. She insisted he get his eyes checked.
What did they find?
Advanced glaucoma in both eyes. He'd already lost significant peripheral vision. He didn't notice, because glaucoma affects side vision first. If his wife hadn't pushed him to get checked, he would have gone completely blind within a year.
And glaucoma is irreversible. Once you lose that vision, you can't get it back. But if you catch it early, you can stop the progression with eye drops. That's why annual screening after 60 is non-negotiable.
Many people think, my vision seems fine. I can read, I can drive. But these diseases are silent. You don't feel glaucoma. You don't feel macular degeneration starting.
And here's another thing people don't realize. Vision problems increase dementia risk. When you can't see well, you withdraw socially. You stop reading. You stop doing activities. Your brain gets less stimulation. Studies show that correcting vision problems reduces dementia risk by up to 20%.
So it's not just about seeing clearly. It's about maintaining brain health and independence.
Exactly. Vision connects you to the world. When that connection weakens, everything else suffers. Get your eyes checked every year. Update your prescription. Treat any conditions early. It's one of the simplest things you can do to protect your quality of life.
And the third critical screening, this one surprises people, bone density testing. DEXA scan.
Osteoporosis is a silent disease. You don't feel your bones getting weaker. You don't know you have it until you break something. And after 65, broken bones are not minor inconveniences. They're life-threatening events.
How common is osteoporosis?
About half of women and a quarter of men over 65 will break a bone due to osteoporosis. Hip fractures are the most dangerous. 20% of people who break a hip die within a year. Not from the fracture itself, but from complications, pneumonia, blood clots, infections.
20%?
20%. And of those who survive, half never regain their previous level of independence. They end up in nursing homes. They need walkers or wheelchairs. One broken bone changes everything.
So bone density screening can prevent this.
Absolutely. A DEXA scan measures your bone density. It's a quick, painless test, takes about 10 minutes. If it shows osteoporosis or osteopenia, which is the precursor, we can start treatment. Medications, calcium, vitamin D, weight-bearing exercise.
When should people get this test?
All women should get a baseline DEXA scan at age 65, men at age 70. If you have risk factors like smoking, heavy alcohol use, family history, low body weight, or you take steroids, you should start earlier.
And how often do you repeat it?
Depends on the results. If your bones are healthy, every 2 to 3 years. If you have osteopenia, every year or two. If you're on treatment for osteoporosis, every year to make sure the medication is working.
I had a patient, 69-year-old woman. She sneezed and felt a sharp pain in her back. Thought she pulled a muscle. The pain didn't go away. We did an X-ray.
Compression fracture?
Compression fracture of her spine. From a sneeze. Her bones were so weak that the force of a sneeze broke her vertebra. She'd never had a bone density test. Didn't know she had severe osteoporosis.
That's heartbreaking because it's completely preventable. If she'd had a DEXA scan at 65, we would have caught the osteoporosis 4 years earlier. She'd be on medication, her bones would be stronger, and that sneeze would have been just a sneeze.
Don't wait until you break something. Get your bone density checked. It's covered by insurance for people over 65. There's no excuse not to do it.
All right, let's bring this all together. We've covered 6 critical medical tests for people over 65. 3 to avoid or be very cautious about, and 3 you absolutely must get.
Number 1 to avoid. Annual comprehensive physical exams, if you're healthy with no symptoms. They lead to overdiagnosis and unnecessary procedures.
Number 2 to avoid. Routine cardiac stress tests if you have no symptoms. High rate of false positives that trigger invasive follow-up procedures you don't need.
Number 3 to avoid. PSA screening for prostate cancer after age 70 for most men. The treatment often causes more harm than the slow-growing cancer itself.
And the 3 you must get. Number 1. Colonoscopy every 5 to 10 years through age 75. This prevents colon cancer by finding and removing polyps before they turn malignant.
Number 2. Comprehensive eye exam every year after 60. Catches glaucoma, macular degeneration, and other conditions that cause blindness and increase fall risk.
Number 3. DEXA scan for bone density. Women at 65, men at 70. Prevents devastating fractures by catching and treating osteoporosis early.
So what should you do this week?
Print this list, take it to your next doctor appointment. Go through your current screenings and ask, why am I getting this test? Is it recommended for someone my age with my health status? What will change based on the results?
Don't be afraid to question your doctor. Good doctors welcome informed patients. If your doctor is defensive or dismissive when you ask these questions, that's valuable information too.
And if you haven't had one of the 3 critical screenings we discussed, colonoscopy, eye exam, or DEXA scan, schedule it this week. Don't put it off. These tests save lives.
Remember, more testing is not always better. Smarter testing is better. Targeted screening based on your individual risk factors.
We want to hear from you. Drop a comment below. Have you had any of these tests? Were you surprised by anything we discussed today? What questions do you have for your doctor?
And if this information helped you, please share this episode with someone over 65. This could literally save them from an unnecessary procedure or catch a serious condition early. Take care of yourselves and each other.